Blepharoplasty or filler for hollow under eyes. My skin is very thin and transparent in that area, and the circle or hollow is sometimes worse on one side, and some days looks all right. Hoping for something more permanent than filler. Would blepharoplasty sag over time, like under eye bags? Would it benefit me to surgically tighten the under eye area, if that's possible?
Thank you for your question. You're asking what is the better option, surgery or fillers to deal with hollows under the eyes. And you've submitted two photos that show this area very well. I think that certainly your question is very relevant, and you describe in your question that your skin is very thin over these areas, and you're asking if the blepharoplasty would be more permanent or will it sag over time? Well, I can certainly help you understand my perspective when I help patients like yourself who come to my practice with very similar scenarios and questions. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and eye rejuvenation is the foundation of my practice. We do so much and customize so many different solutions to help patients who come to us from around the world. So to begin with, it's very important for you to have a basic understanding of the principles that guide what the solutions are. So when you in your photo, what I see is the under eye puffiness. I also see the relative hollows that are below the eye. I also see relative volume loss in the cheek area. And then the skin quality is consistent with your type of skin. It's relatively thin underneath the eyes. So when you ask about permanence, and this is something that people always want, they want something that's a long-term, long-lasting solution. But understanding that facial aging, and especially with the genetics as well as the environmental factors, makes long-term solutions variable in their potential as far as longevity is concerned. So let's begin with the basic issues. We'll start with the under-eye fat pockets. The under-eye fat pockets have prolapse forward. We refer to it as lower eyelid fat herniation. And so for that area, I would consider, and this is again in the absence of a physical examination, I would consider a procedure like a lower eyelid blepharoplasty. Now this is a procedure where I would go from the inside of the eyelid, which is a transconjunctival approach, from the inside of the eyelid to address the fat pockets and reduce and reposition as is appropriate. This way the under eye area will not have the bulge of the fat pockets, which I feel contributes to the hollow that is perceived. The bulge is like a mountain, the hollow is like a valley. Then the question comes up, what about tightening the skin? Well, very often it is a misinterpretation that skin quality thinning or thinning skin quality is best treated by pulling and tightening the skin. A lot of times my colleagues will have done a transcutaneous approach where they go from the outside and take away skin with the intention of trying to make the skin tighter, and what ends up happening is the lower eyelid retracts or everts, a condition called ectropion, which means the eyelid, and now there's a skin shortage. So I think that from my perspective, I take the approach that the lower eyelid skin, especially in a lighter skinned person, is very, very thin and should have minimal unnecessary manipulation. So I would typically do in a situation like yours, I would do something called PRP injection, which is called platelet-rich plasma, or PRP, which is the concentration of the wound healing and growth factors that stimulate collagen, stimulate blood supply, and improve skin quality. On the surface point of view, with the fine lines and wrinkling, I would use something like a fractional CO2 laser or fractional erbium laser to help improve the quality in the outside. Now the challenge then comes to the relative hollows. Now, the relative hollows are best usually addressed with volume and by using fillers. So essentially, my thinking would be is that I would evaluate the under eye tear trough area after surgery and see if there's any indication of there being some volume loss opportunities to treat with a filler such as Restylane or something that's in the lighter hyaluronic acid family. Now, one thing that's often overlooked when people focus on the under eye hollows is the areas of the cheeks. And when I look at the eyes, I don't just look at the eyes, I look at the eyes in combination with the relative cheek projection. So when I talk to my patients about this, I'll often suggest that we do something called structural volumizing. Structural volumizing means placement of fillers that are longer lasting. These are fillers like Juvederm Ultra Plus or Juvederm Voluma, placed at the bone level. And at that level, the material actually creates better structure, creates more definitive angularity and structure to the cheekbones. And it balances out the area of the eye. A lot of times people focus on the area that bothers them the most, but they miss the forest for the trees. They miss the whole picture. So I think that there is a value there, especially with the long-lasting fillers, to help with the eye aesthetics. Now, when I say long-lasting, we're talking about 1 to 2 years to maximally have this full correction and the longevity that goes with it. Something to really understand is that permanence, when it comes to soft tissue, is very difficult to really achieve. It's really, I look at the skin quality and the challenges of dealing with genetics and environmental factors, whether it's sun exposure or the breathing environment, such as smoking or secondhand smoke. We're dealing with issues that ultimately, or factors which ultimately cause breakdown and causes aging. So in a way, there's always a benefit to a maintenance process, whether it's getting PRP injections every 3 to 6 months, whether it's doing some kind of either ablative or non-ablative laser, such as Q-switch laser to stimulate collagen or radiofrequency. But basically, looking at skin quality, there is a downward direction if you don't do anything, and there's mitigating those changes and getting enhancement if you do something. But it's not like surgery to always be a definitive one-off type of procedure. So I think you have to consider this as embracing a plan besides having a single item solution. Certainly a surgical procedure such as lower eyelid blepharoplasty, PRP, fractional CO2 laser will be an improvement. But to try to reach the maximum potential to look as good as possible, something like structural volumizing and a strategic placement of fillers and the use of PRP on a schedule that makes sense to you, both in terms of logistics and financially, will give you probably the best long-term outcome. I always say that it's kind of like going to the gym. You can't go to the gym once and expect to be in good shape forever. These treatments that require things like PRP or non-ablative laser are basically pushing your body to generate collagen, and without any kind of stimulation, it'll go only in one direction. So meet with qualified, experienced cosmetic surgeons, learn about your options, and try to look at this perspective of looking at the eye, not in isolation, but at the eye as it relates to the cheek. And I think it'll give you a sense of what I'm describing. So I hope that was helpful. I wish you the best of luck, and thank you for your question.